What we realized with some of the patient conferences that we were holding was that we had a very diverse, multidisciplinary group of experts across the country, but we really never met in one place.
And I had the experience from Europe because we organized the European Neuroendocrine Tumor Society, NANETS. And then there was a number of colleagues here in the US and said we should have the same type of organization.
NANETS really is a professional medical organization, and we've directed all of our activities to educating clinicians who look after patients with neuroendocrine tumors at all levels.
I think it really does bring the community together, and it focuses like the whole heart and center of our organization is the patient and what we can do to not only improve patients' outcomes but improve the understanding of these diseases.
And providing them with the most up-to-date information about available treatments, treatment options, treatment sequencing, diagnosis, optimal imaging.
I think as a researcher, the benefits certainly relate to understanding the latest advances and having the opportunity to meet with collaborators and work together towards a common goal of improving the care for this disease.
For me, NANETS has been really important as a way to bring all that information together, to share that information, to learn from one another.
Every time I come to this meeting, I see that someone in some discipline that I perhaps haven't been staying particularly abreast of has new and exciting things to bring to the forefront.
So we hope that the regional conferences also bring people into the fold who may have an interest, whether they're oncologists, surgeons, gastroenterologists, endocrinologists, interventional radiologists, geneticists, etc.
NANETS, particularly through their guidelines efforts and through the regional conferences, are really a way that we can help keep community providers up to date. The NANETS guidelines tend to go a little bit deeper into management scenarios, and I think that that's our opportunity, is to really provide focused education. So I've been a recipient of a lot of mentoring through NANETS. I think having joined as a very junior faculty member, I immediately received mentoring from leaders in the field. And I think in a disease that is rare, junior faculty need to develop a mentoring network that may go outside of your institution. So this is really the organization within which I found that.
Unlike any other community, it really fostered an environment that allowed junior faculty members to really thrive and do well.
Always want to see the young doctors coming just after graduation and give them some information about these diseases and try to keep them in the team with research programs that they can perform.
Over the years, I've been able to meet many other people who've been able to share their information about neuroendocrine tumors to help me better understand the disease and to help me better take care of patients with the disease.
It's a good way for doctors to learn the latest advances in both diagnosis and treatment.
So if you have an interest in multidisciplinary management and care of patients, we are a perfect place for you to come to. But that doesn't necessarily mean it has to be at the expense of your primary interest as well.
It has allowed me to see how important a multidisciplinary approach is, that it's not just all one field, everybody has something to offer.